I'd like to call this meeting to order. I'd like to welcome each one here for our September 15th, 2025 meeting. I'd like to begin by acknowledging the land on which we gather is the traditional territory of the Anishinaabe, Ottawa, and Mississauga peoples. That the Council of the Township of North Huron hereby approves the agenda for September 15th, 2025 council meeting as presented. May I have a mover? Deputy Reeves, seconder, Councillor Van Hitterson. All in favor? Carried. Disclosure of pecuniary interest in the general nature thereof. Seeing none. Consent agenda. That the Council of the Township of North Huron hereby adopts consent item 4.1.1, and further that the Council of the Township of North Huron hereby receives consent items 4.1.2 to 4.3.5 for information purposes. May I have a mover? Councillor Whitfield, Councillor Wright. Would anybody like to pull anything from the consent agenda? Seeing none. We have a mover. All in favor? Carried. Public meetings, hearings, and delegations. At this time, I'd like to welcome Edith Oberle and Maurice Voisin from the Saugeen Hospice, request for donation toward building of the Saugeen Hospice. At this time, I'll ask them to come forward and give their presentation. Thank you.
Here so you can kind of see that. I'd like to introduce Edith Oberle. She's a current board member at the Saugeen Hospice. Edith was a registered nurse for 47 years, and she finished her career at the Chapman House Hospice in Owen Sound. And I'm Maurice Voisin. I'm a recent board member since May. Both Edith and I live in South Bruce in the Mailme area. And thanks very much for welcoming us today. We've got just, I think, 9 slides. I'm not going to read the slides, just going to try to add a few pointers because I know your time is valuable. But I'd like to begin with a powerful phrase: compassionate and end-of-life care closer to home. That's our goal. And so it's more than a tagline. It's a vision or a promise, and it's a deeply human need. It's something that, that we know and feel deeply about. And we're here to talk about Saugeen Hospice as a place for all of us, a place where dignity and comfort and community care come together to support individuals and families during life's most tender moments. And it isn't just about a building, it's a building where a future where care is personal and accessible and rooted in the values of our community. So let's explore a little bit why hospice matters. Let's press this. Oh, you got it. Sorry, you're ahead of me. According to statistics, 75% of Canadians want to die at home, but only 15% do. And then there's some figures there about the number of deaths in Grey Bruce, annualized, and our aging population that, according to Ontario Health West, in the projections are that over the ages, in 10 years, 35% of our population will be over the age of 65. And then at the bottom, there's just talks about a 2024 Ontario Health West needs analysis, and that Grey Bruce needs 18 hospice residence beds, and currently we have 12. So the 6 beds that Saugeen Hospice is proposing would fit that need. Okay. And there's just an architectural kind of overview of the hospice. One of the suggestions that we've had from other hospices is to build lots of parking spaces. So we have 50 parking spaces targeted for the hospice, plus 3 horse tie-ups for our Amish and Mennonite community. When shift change over and some people with large families, we have a lot of large families in our area, that if they come to visit the person in the hospice, we need lots of parking space. So that's the reason that we would like to do that. And We'll move on here. And what is a hospice residence? So, in partnership with our communities and the Ministry of Health, our goal is to plan, design, build, and operate a 6-bed hospice residence that brings compassionate end-of-life care closer to home, and creating a space that provides dignity and respect. And why it's important, the compassionate end-of-life care, support for families, a connection with their community so that the person from their church or religious affiliation can visit, their next door neighbors, children, grandchildren, and family members. It also hopefully will reduce hospital admissions and emergency visits, and it frees up acute care beds for other patients. Um, there's no charge to the families, so no matter what income level you have, that everyone will be welcome there. And that we'd like to create a home-like setting so that person has autonomy and personal values. And there's some snapshots of our volunteers. We have Hike for Hospice. The bottom right-hand corner is a garage sale that we have a great group of volunteers. We probably have somewhere in the neighborhood of 75 to 80 volunteers currently working on different events. We had a saddle up a couple of weeks ago for horse riding, and we also had a pedal for hospice, and they're all initiated by volunteers in our community. So that's kind of a visual of the land just east of Walkerton. So the land, 3 acres of land, has been donated by Brockton. We're very grateful for their assistance. And then this map and the map on the right-hand side there, you can see kind of the 4 future hospice locations. So the one in Owen Sound is called Chapman House, and there's one in Southampton. There's a couple of beds in Tiverton, and that bottom one on the south, that will be the proposed Saugeen Hospice, which will have 6 beds. And we were incorporated as a not-for-profit community corporation in 2021, and we hope to serve the area. You can see that Wingham and North Huron is part of our catchment area, and we're anticipating and we hope that we'll welcome our first resident sometime in 2028. So that's the goal. And we can update this. Our fundraising campaign goal based on the estimate to build was 10 million. Donations and pledges to date, we can update that. It's now closer to 7.4 million. So we're kind of at that 75%, very close to 75%. And we've just really started to campaign since January. So over the last 9 months or so that we've approached the businesses and individuals. So we have a thermometer in Walkerton and Mildmay, and I think perhaps in Hanover. And there's just an overview of the back of the hospice. You can see that individuals there that are in the hospice will have like a terrace, and they'll be able to come out and enjoy the sunshine and fresh air, and you could see that previous view where there's a field right to the at the rear facing the hospice. So it is a very very nice setting.
And the beds we have ordered are called cuddle beds. And they're an electric bed. They're 35 inches wide, so they will go through an ordinary doorway, but you can expand them to 47 inches. So that if there's a family member that just wants some cuddle time with the person, or the family pet wants cuddle time, the bed will expand to accommodate it. It's also pilot driven, so the nurses will not have to push the bed. They only have to steer it. So less back injuries.
And then just the bottom statement there, we want to bring all the counties and municipalities to the table to ensure that we reflect the collective values of our area and the needs and strengths of our entire region, and hence the meeting today. And so we feel that together we can build a space that reflects the heart of our region, and we'd like it to make it a place where every municipality sees itself and its people reflected in the building. And I think that's probably the end of our slides. We wanted to leave time for questions. We didn't want to bring in a half-an-hour presentation. Your time is limited, and so we thought we could open it up if it's okay with you, just for some questions. We may not have all the answers, but we can find the answers and communicate it back to you. But we wanted to leave a little bit of time for some dialogue.
Okay, thank you very much for your presentation there as well shown there on those slides that you gave to us. So at this time, are there any questions from members for the two folks here? Go ahead, Councillor Wright, please.
Thanks, through you, Reeve. I'm just curious how the admission policy with relation to geography works. Like for a hospice like this, is there a waiting list that anyone in the province can apply to, or is it administered more for local residents, or is it set up by board policy, or is it Ministry of Health guided? I don't know about that, so I'm just curious about that.
It's a little bit of everything. Sometimes if the family are from this area and they want their parent who is from a different catchment area admitted, no, they can come here. So it's not the same as the hospitals where they have their own districts. No, there is a list mainly of the people in your area, but outsiders are still welcome. It's wherever the need for hospice care is the most.
So since there isn't a hospice now in Bruce County, like in the Walkerton area, so those people would be filtered out to other areas, to Tiverton or whatever. So I guess our goal is to make it closer to home. And as you can see, it's a fairly large catchment area. So, but I guess we feel that the more hospice beds that are available, the more choice people will have, and the better opportunity that they will have a hospice bed to go to when it's needed. So if one hospice would be filled, and we would be able to, once Saugeen Hospice is up and running, that would fill a void for our catchment area. But the board will not decide on people, or won't go by who donated this or that. It'll be a medical director that would do it for the region, to my knowledge anyways. Yeah.
You know, case managers go out into the community and they will do an assessment sheet. And there is a scale of exactly where that person is at. And the assessment is done and submitted for admission, similar to a hospital admission. The other thing with hospice is the Ministry of Health feels the length of stay max is 3 months. So you don't want to bring people in too early. You want to bring them in at the right time. But you also have to realize most people, when they're admitted to hospice, actually get better in the first 24 to 48 hours. Only because if they've been at home and the pain hasn't been under control, they haven't been eating properly, not taking their meds properly, that you will see the improvement in the first couple of days, and then watch them as they go through their end-of-life stages.
I think out of the places we've had questions about what's a typical stay, and according to statistics, it's kind of like 10 days to 3 weeks is kind of the common number of times. But like Edith said, a person could be there for 3 months, up to 3 months.
Okay, we have a question over here. Go
Sure.
ahead, Councillor Palmer.
Yeah, thank you, Reeve. Is the building designed that it can be expandable?
Yes, the architect has designed that so it could accommodate in the future an additional 3, I think it's 3 beds?
Yeah, 3 beds. but we're building 7. We're only licensed for 6. The 7th bed would be used when someone passes away. Hospice isn't like the hospital. There isn't a rush to get the people out. You will admit to the 7th bed so that the family can have their time. If there's some family that haven't arrived yet, they've got time, so that rather than the family being rerouted to the funeral home, they would still come to the hospice. And even though they weren't there for their last breath, they will at least see them in the setting they were in. So hence the 7th bed, but we have enough land to add another 7 and take it up to a 10-bed hospice.
Okay, thank you. Any other questions from any members? Oh, go ahead, Councillor Wright.
Not really a question, but to put you on the hot seat, Reeve, is this possibly something which would qualify for the Vance funding? I believe part of that is healthcare, is it not?
Yes, no, Francine back there, she's in.
I'm just curious because if, whether we have to have a hospice in Wingham or if it just has to serve Wingham in its catchment area.
I think we'll have to re-question that and make sure we have the right answer for sure on that.
Okay, just an idea.
Never
of
come
what that
forward
funding source
before,
is.
so,
Okay.
okay. Okay, at this time, would somebody like put forward a motion for staff here? Go ahead, Councillor Van Hitterson, please.
Did we receive this presentation for information?
Okay.
Yeah.
Okay, thank you. Any discussion? Okay, this way. Oh, seconder, please, Councillor Palmer. And any more to discuss at all? Go ahead.
Well, I would just say, Reeve, right, I'm not sure if our presenters are aware, but, budget season is coming up, and when's the cutoff for written submissions, for donations?
Clerk Lamb.
Yeah, through your worship, to answer Councillor Wright's question, so any donation requests for the 2026 budget year would need to be received by November 1st.
Thank you.
Okay, thank you. Okay, so what do I need? Mover and seconder, all in favor? Carried. Thank you very much for your presentation, folks. Okay, at this time, we're moving to 6.3.1. RC 2025-10 Seniors Active Living Input Group. Terms of reference. At this time, I'm just going to have Ms. Taylor to come up and just sort of, as these folks go out, this is something new for us, so I thought she could just maybe give us a little update on that. Thank you.
Hi there, everyone. My name is Tennille, and I'm the new Seniors Active Living Coordinator for the Township of North Huron. And on June 2nd of this year, I began my role as the Seniors Active Living Coordinator for the Township of North Huron. Through provincial funding, it has created the opportunity for the township to become designated as a Seniors Active Living Center. Through the last 3 months, multiple programs have been introduced to the community, such as cards, coffee hours, and art classes. Coming up, we will be having lunch and learns, fitness programming, and educational information sessions and classes. Part of this funding, which aligns with number 55 of the Township of North Huron's Parks, Recreation, and Cultural Master Plan, which states that a Seniors Advisory Committee be created to provide a collective voice for issues that matter to older adults and seniors in North Huron. The committee will play a role in the development of an age-friendly strategy to identify how the township's parks, recreation, and cultural opportunities can be enhanced to be more welcoming to older adults and seniors. Through developing this committee, it will enhance programs in the following ways. The first would be program development. It would provide feedback on what activities, services, or supports are most relevant and appealing. It would suggest new program ideas based on their lived experience and community needs. It would help ensure that programs are culturally appropriate, accessible, and inclusive. The second would be program evaluation. The committee would share honest feedback on what works well and what needs improvement. It would identify barriers such as transportation, timing, cost, and technology. And it would provide suggestions for adjustments to make programs more engaging and effective. The third would be communication and outreach. The committee would act as ambassadors by spreading the word about programs to their peers. They would suggest the best ways to reach seniors such as posters, phone calls, social media, newsletters, or word of mouth. And it would also help shape messaging so it resonates with older adults. The fourth would be representation. It would ensure diverse voices of seniors are heard, so seniors of different ages, cultures, abilities, and backgrounds. And it would advocate for seniors' needs to counsel, service providers, and community partners. The fifth would be partnership and trust. The committee would build trust between seniors and program coordinators. It would create a sense of ownership, programs that feel like they're by seniors for seniors. And it would encourage higher participation because people are more likely to join something that they've helped shape. And lastly, problem solving. It would identify gaps in services and brainstorm practical solutions and share lived experience that staff may not be aware of and offer ideas to make programs more sustainable and cost-effective. So my report is seeking feedback from council as well as endorsement to create this committee.
Okay, thank you. At this time, do we have any questions for, go ahead, Deputy Reed, please.
Thank you. Through you, Reeve. As this is another, it's a very needed and useful tool for North Huron to have this position and these responsible or not responsible, but these activities available to our aging ratepayers. Is there anything in the process that, because it's funded through North Huron, that North Huron benefits from it? We have a large input, a large drawing area outside of the municipality. I just wonder how the funding is going to be allocated to any of these projects and any of these initiatives.
So I think I'm going to ask Kelly.
Go ahead,
Okay.
Director Stice, please.
Through you, Reeve Heffer, to Deputy Reeve. I think the seniors input group that Tennille is presenting on certainly would be prioritizing the residents of North Huron so that we have their voice at the table. From an overall perspective, we don't have a residency requirement for participation in the groups. Because part of it is we want to engage and gather people, but when the province introduced the funding for the Seniors Active Living Centers, they actually awarded it to 100 centers. So because they saw the value of reducing senior social isolation. So it's likely that we will see people coming across our border, but it's likely too that North Huron residents might go elsewhere because they might have a project or offer a program that's appealing. So we have things like our pool is a unique offering that brings people here, but another group, and I know Tennille's been partnering with other active living centers so that we're coordinating services. We don't want to have too much redundancy too close by.
Follow-up? Yeah, just a follow-up question. Then the granting process, was it a perpetual granting or was it a one-time granting? And I'm just curious if this financial lack of a better word, burden is then going to fall onto the municipality to maintain going forward?
Through you, Reeve Heffer, to Deputy Reeve Faulkner. The province opened up designation for seniors active living centers last year. This was the second time they had done that, but the initiative or the focus for the provincial government was to enhance more centers. We don't see that opportunity will come up again, although we're not sure. So once you've become a seniors active living center, then you have access to the fund, the Seniors Active Living Fund. So when we entered into that agreement, we did so with the understanding that we would be able to access this fund for as long as this fund is available. And so as per a former report to council, Tennille's position is based on that funding.
Okay. Any other questions for Tennille? Go ahead, Councillor Wright, please.
Yeah, although it's another funding question, I guess I've just, the mandate, right, is that the input group will advise on strategies, policies, programs, and services that promote healthy aging. But I just wouldn't want to get into a situation if they recommend these programs, but then there's no funding to run those programs. It wouldn't be a very positive cycle. So like, how is that intended to be managed, right? Like, how do we intend to make sure there's actually funding available for the programs and services that they would recommend?
Okay, I'll have to ask Kelly, yeah.
So through you, Reeve Heffer, to Councillor Wright, we will build some of that into the planning for these programs. So some of the programs, we've been able to partner with organizations like OneCare, who are offering, and we did this as part of our application to the ministry, where we said we will provide the space at no charge if you provide the fitness program, which is a falls prevention program, so certainly not a duplication of what we're doing, at no charge to residents. So part of Tennille's role is to look for partnerships where we can collaborate, because the whole goal of this program is to reduce social isolation. There might be programs that Tennille runs where there is a cost. And so it will be looking at how do we balance out the budget. The funding also allows for some minimal funding to deliver programs. And so that's kind of the balance that she and I will be working on to make sure that we're delivering services that are fiscally responsible, fiscally managed within this grant portfolio.
Very good. Any other questions for Tennille? I'd just like to say, anybody is free on a Monday morning, you want to go down and have a coffee with a bunch of seniors, and some of those seniors aren't quite as old as I am, I know that, and it is really well used. Didn't have time for a coffee, but they have 101 questions for you, and it's very, very good. You get to hear what they're thinking, and it's a good time. Councillor Van Hitterson, please.
Thank you, Reeve Heffer. Yeah, that was actually a little bit my question, like seniors starting at 55, but they're also 90, some of them. So are you going to make different programs? Are you looking for people in the country that are normally isolated? Or are you looking for specific groups? Or
I think through you, Reeve Heffer, that we are looking for anybody and everybody, like anybody who is isolated, anybody in the country, whether you be 90 or 55. Sometimes bringing those two age groups together is pretty special, and it can bring out some really good conversation and kind of get them out of that social isolation too. So yeah, programs for everybody.
okay. Yeah,
Thank you. Councillor Palmer, please.
Thank you, Reeve. Tennille, you're talking about social isolation out in the country and what have you. What about transportation?
So through you, Reeve
Yeah.
Heffer, yeah. So we're working on transportation as of right now. We are partnering with OneCare with their transportation services. Unfortunately, right now they're having a hard time finding the transportation drivers, the volunteers to drive the vehicles. So we are looking at partnering through that way, as well as in the future, hopefully, different forms of transportation for the older adults to get to the programs to decrease the risk of social isolation.
Okay, that looks like all the questions from members. Okay, would somebody like to put a motion for either staff recommended or another motion? Looking for, go ahead, Counselor Palmer, please.
Yeah, I'll make the motion that council endorses the terms of reference for the Seniors Active Living Input Group.
Seconder? Counselor McBurney, all in favor? Carried. Thank you very much.
Thank you.
At this time, we'll move on to 6.3.2. Lease agreement with Maitland Valley Conservation Authority for the Turnberry Floodplain Conservation Area, Galbraith Park. Are there any questions for Director Stice here, please? Pretty clear in the report for sure. Okay, would somebody put forward the motion then? Counselor Van Hitterson, please. Okay, go ahead. Do you want to read it, please?
Yeah, so the motion would be that the Council of the Township of North Huron hereby receives the report prepared by the Director of Recreation and Children's Services dated September 15, 2025, regarding the lease agreement with Maitland Valley Conservation Authority for the use of the Turnberry Floodplain Conservation Area, Galbraith Park. And further, that council directs the Director of Legislative Services clerk to prepare a bylaw for the October 6, 2025 regular meeting, authorizing the Reeve clerk to sign on behalf of council the lease agreement with the Maitland Valley Conservation Authority with an effective date of January 1st, 2026.
Okay, the mover, need a seconder? Counselor Wright, all in favor? Carried. 6.3.3, Vance Fund Application Action Plan. Are there any questions for either our coordinator, Francine, or Director Stice with this? Francine's able to take any questions at this time? Go ahead, Counselor Van Hitterson, please.
Thank you, Reeve. It is not, maybe not again, a question for Francine or for anybody, but I would like to have some clarity from the Vance Fund where, what area and what projects and what is eligible, because last year the Belgrave Playground Committee was told that they would be eligible to apply for the Vance funds. Apparently they are not eligible right now. We're looking at funding maybe to help hospice or something else that is not exactly in Wingham. So I would really like a clarification from the Vance Fund, who, what, where is eligible to receive funding.
Okay, okay, we'll make sure that gets plotted. Oh, yeah, that's being added to the motion at this time. Are there any other questions for Francine, these projects? Go ahead, Counselor Palmer, please.
Yeah, thank you, Reeve. So the area, the territory that qualifies, is it strictly in the Wingham area? Because I know the golf course received, but I know it wasn't all used or came back. But it was decided to do the golf course, which was a surprise to me. So if you could just give us that answer. Territory.
My understanding is that, through you, Reeve Pepper. My understanding is that the Vance funds are only to be used within the geographic borders of Wingham. I'm not fully sure why or the reasoning how the golf club got their funding last year. That's out of my hands. But from the program guidelines and the stipulations, it has to be within the geographic borders of Wingham and to the majority betterment of the Wingham community and residents.
Thank you. Any other questions for Francine? Okay, seeing none. Go ahead.
So with the addition of Councilor Van Hitterson to the staff recommended motion, your motion could be something along the lines of that the Council of the Township of North Huron hereby receives the report of the Asset Management Coordinator dated September 15th, 2025 regarding the project scope of the 2025 Vance Fund Application Action Plan, and further that council approves the action plan prepared by the Township of North Huron staff for the Vance Fund application with a focus on the following three initiatives. One, upgrading the Wingham Areno sound system. 2, replacing the ball diamond lighting at the Riverside Park ball diamonds. And 3, completing necessary capital work on the pedestrian walking bridge. And further, that council requests written confirmation from the Vance Funds Committee / Waterloo Community Foundation regarding the eligibility criteria such as geographic boundaries for the funds.
Okay, that covers yours, Councillor Venger. Okay, thank you. We have a mover, a seconder. Councillor Whitfield, all in favor? Carried. (6.5.1) FR 2025-07 Portable Fireground Radio Audit and Equipment Replacement Request. Are there any questions for Chief Krager at this time? Seeing none, would somebody like to put motion forward? Deputy Reeve, please.
Yes, I'd put to accept the motion as stated.
Okay, mover, I need a seconder. Councillor McBurney, all in favor? Carried. CAO 2025. Oh no, facade, yeah, 2025-21, Commercial Facade Improvement Grant Application 405 Josephine Street, Wingham, Super Storage. Are there any questions for our EDO? Or our CAO maybe? Oh, there she is. There. Are there any questions about this facade improvement? No? Pretty straightforward? Great. Thank you. May I have a mover? Deputy Reeves, seconder. Councillor Palmer? All in favor? Carried. Any notice of motions? So 6.1, oh, 0.2, yes. CAO 2025-2022 update to the Town Hall Theater rental policy. Are there any questions for CAO Santos, please? Seeing none? Oh, sorry, go ahead. Mike, please.
Sorry, Reeve. I'm wondering who the possible designates would be regarding booking.
Okay, thank you through you, Reeve, to Councilor Palmer. Currently, we have a backup system. So if our community engagement coordinator is not available, it will go through Rochelle, through the recreation department. So we have both abilities to book those facilities in the absence of one or the other.
What about if it's after hours? I'm not sure if you're receiving anything then, but it could happen.
Yeah, so we're looking at the communications going to a collective email so that it can be responded to. Normally bookings do take time to identify availability of the space and everything. So it's typically not something that we book. They call the day before. There's usually timing, but also we have a schedule that has dates held already or dates that are available. We can confirm and then work through the application process to see what their needs are. So those details are available. From there, we look to provide the support information through the new house manager to support the day of events, but then everything pre-event is going to be coordinated through either our community engagement coordinator or through Rochelle, if that's the necessary role. Okay.
Thank you. Any other questions for Sales Santos? Go ahead, Councillor Wright, and then go to Deputy Reeve.
Just kind of a details question. For events which are already booked but haven't happened yet, will this policy come into effect for those, or because they were booked under the existing policy and form, does the old policy apply to those bookings?
Okay. Certainly the booking will be held and committed to. We have contracts already signed for some of those. So we will certainly abide by the terms that we put in place. However, should those that are booking look to want to expand to provide some of these additional services during their event, we can coordinate that, but that'll be spelled out in a formal agreement and an appendix to identify the needs and concerns and how we can try to address those should they want to implement, again, whether it's food or alcohol or that, we'd certainly oblige that in advance of the day.
Deputy Reeve, go ahead, please.
Thank you. Through you, Reeve. I'm just curious as to the lineage of this bylaw, the rental agreement policy. Is this for any certain length of time? This council spent a lot of time in the last almost 2 years now trying to find ways, different ways of procuring this space and having it run to some kind of proficiency. Will this agreement be in place for a certain length of time before it's revisited again? Or is this an open-ended where we'll have to face this again in 2 months?
Go ahead, CAO, please.
Well, certainly the evolution of moving into a business that provides opportunities for the theater usage is one that we want to be able to respond to what is I think being requested from the market. If there's any adjustments that we would make, it would be more on day of events in terms of functionality and in requirements of the facility. If there are needs for maybe improvements or additions that we currently do not provide as part of service, that would come forward as an update to policy. So certainly in terms of how we've been doing business in the past, that will be maintained in terms of what we provide and don't provide. Like, for example, we currently don't provide the ability to sell tickets for those venues or for those bookings. Should that change, and as we get more experience about the space and we get more confident in the usage of the space, if there seems to be a demand or opportunity to invest in something like that, that's covered by a lot of the bookings, then perhaps we would look at that as a change in the future. But that's not something that would be 2 months down the road. It'd be something after we start to get some good data and information about our experience in the theater industry and booking the facility.
Okay, thank you. Any other questions for our CAO Santos at all? Seeing none, may I have a mover? Counselor Wright, seconder. Counselor Palmer, all in favor? Carried. Any notice of motion? Seeing none. Bylaw 9.1, bylaw number 67-2025, Wingham Ironman Junior Hockey Club Facilities Usage Agreement. May I have a mover? Counselor Whitfield, seconder. Counselor Deputy Reeve Faulkner, all in favor? Carried. No other business? None? Council reports. Reeves activity report. Just like to give a shout out to our EOD. She was at the job fair. They did an excellent job there. We had 31 tables there. 30 of them were busy with people looking for workers at the Knights of Columbus here. And it's just a great evening. A lot of people I saw coming in with resumes and whatnot. And I know some of the hospital ones were happy with what they got, like some interview, talking to people. So again, kudos out to Ritu and her crew, and it's just a good night. I'd like to just, I had to give regards at the Threshers, just at the opening of it there. They had down there with Mr. Ben Lobb and Lisa Thompson's were there. It is a good afternoon. And then I just along with that, I'd like to commend the Fireman's Breakfast that morning. It was just absolutely great. I was there the first one. I know they had another one. I know Councillor McBurney was in it. And it was really, really good. I saw at least 16 firemen working there, and I know there'd be some more. And we also were privileged to have a greeter at the door by Chad, and he just welcomed everybody in. And again, it's a good testament of the work that was done there. Again, the amount of people they put through there, I don't know how they do it, but it was very, very good. And also with the Belgrave Fair, it was just a great day there. I had to bring regards on behalf of the municipality there, but it's just good seeing all those kids line up and then walk around down Jordan Drive. It's very good. And they said there's going to be 2 more schools there next year that might, and I think it was about 550 students, but I'm sure Counselor Palmer will be talking about that. With Terry Fox yesterday, they had the walk here. There was 260 at it, I heard, and just giving regards on behalf of the township, welcoming. There are people from all around here coming to remember that time. It's very close to some people there, and we heard testimonies of that there, and it went really, really well. And I think they came up, they're just about at the 40,000. So it's very strong. I give kudos out to Steve Jackson and Mr. Scott Miller. They do a lot of work, and they have people behind the scenes helping them, but they do all the putting out to get people coming to it. And it's just a great event there and it was in its 37th year, I believe. And there's a couple people have been there at each one, each year of it. So it is a strong tradition. And then last of all, from the county, I'd just like to mention, we got another 300,000 from the ministry for the daycare in Blythe. So that is going very, very well. It just shows how it is really wanted by the county and the people here local to the Blythe area and here too. We just that is going forward very, very well. That's mine. Is there council member board and committee reports? Councillor McBurney, please.
Thank you, Reeve. This past Wednesday, I went to my CHIP meeting. We had a very productive meeting. Right now we're in the final stages in the review of our off-road vehicle map, which includes the rules of the road. And the document it's folded. It's not very big, but it's about a 7-fold pamphlet. Anyway, then the CSWB for Hearing Oversight Committee, I think Chip's been bumping me out of that one because they're scheduled the same day. I believe I'll be able to get to the one in November. That's my report.
Thank you. Anybody else? Councillor Palmer?
Yeah, thank you, Reeve. Yeah, the Belgrave School Fair, it was last Wednesday, and it's the 103rd anniversary, which is amazing. I've got to mention that if it wasn't for the volunteers, those that gave donated time, those that donated money, the fair wouldn't work, just wouldn't go. Not the outside part anyways. And even the inside, it takes volunteers to do all the judging. And my wife was there for 2 hours that one night, the night before. And she said it was just going on and on. So it was so good for the kids. It's a learning experience. And yeah, and for those of us that volunteered, it was fun. Get hoarse for yelling, but that's the loony bin for you, and I fit right in.
Go ahead, Councillor Van Henderson, please.
Thank you, Riva. For the Physicians Recruitment Committee is putting the finishing touches on their memorandum of understanding for participating partners. Jan, our physicians recruiter, is very busy with consultations with eligible national and international candidates, learning about the community and trying to overcome the hurdles that are a lot of administration before somebody new can come into a community. Annual budget is in process and the next meeting is in December.
Thank you.
Thank you.
Okay. On to 11.3, any comments by members? Seeing none, we'll go to next meeting and announcements. Next regular council meeting will be held on Monday, October 6th, 2025 at 6 p.m. Here in the North Huron Council Chambers. And the next Wingham BIA meeting will be held on Thursday, September 18th at 6:30 in the Hot Stove Lounge. And the next Blythe BIA board meeting will be held on Thursday, September the 25th at 8 a.m. in the first floor meeting room at the Blythe and District Community Center. Are there any other announcements? Go ahead.
The Bellway Playground Committee is putting up a cornhole tournament on October the 11th. All the information is on Facebook and they can still have a couple of more teams to participate. Thank you.
Okay, thank you. Okay, at this time, we'll go to number 13, closed session and reporting out of closed session that the Council of the Township of North Huron hereby proceeds at 6:49 to an in-camera session closed to the public under section 239, 2D and F of the Municipal Act to discuss the following: labor relations or employees negotiations, results of salary and benefits market review, and secondly, advice that is subject to solicitor-client privilege, including communications necessary for that purpose, solicitor advice regarding litigation. And further, that the CAO and the Director of Legislative Services clerk remain in attendance. May I have a mover? Councillor McBurney, seconder. Councillor Van Hitterson. All in favor? Carried. We'll take a 5-minute break. Santos, report out, please.
Okay, note that council did meet in closed session just previously under section 239(2)(d) and F under the Municipal Act to discuss two matters, one regarding labor relations and employee negotiations regarding a results of a salary and benefits market review, and further advice was also that was provided subject to solicitor-client privilege, including communications necessary for that purpose, which was solicitor advice regarding pending litigation. Council provided direction on those two matters for administration to proceed, and we'll look forward to a further report.
Bylaw 68, 2025, conformatory bylaw, mover. Counselor McBurney, Counselor Wright, all in favor? Carried. Adjournment that the Council of Township North Huron agree that there being no further business before council, that September 15th, 2025 regular council meeting be hereby adjourned at 8:39. May I have a mover? Counselor Palmer, Counselor Whitfield, all in favor? Carried.